Hi everyone! So I guess if you made your way here, you are trying to learn more about the cervix. Before we get started, I just want to make the disclaimer that I'm not a healthcare provider and I do not dispense medical advice. So if that's what you're looking for, go look somewhere else. It's not coming from me. This particular video started as a project for my sociology of women's health class. I am a college student, and in class we are focusing on the topic of cervical self-exam, and I realized that, or during my research, I realized that there were only like 2 videos on YouTube that discussed the cervix from a feminist perspective. So I decided, well, screw it, I'm gonna make my own video. And here we are. Hope you like it. What the heck is a cervix anyways? Anybody know? The cervix is the only portion of the uterus that sits inside the vaginal canal. It sits right there at the top, kind of hanging out. Some people say that the cervix looks like a donut, like a small donut, and I kind of disagree because I actually think that it looks like one of those toys, the sea cucumber toys that you played with as a kid. I got one right here. I'll show you. Sea cucumber toy. So one of these toys, if it was a little bit rounder, maybe pinker, that's my opinion. But if you want to see actual examples, you can check out the Beautiful Cervix Project. They are an online website that takes and posts awesome pictures of women's cervixes. Check them out. I will put their link in the description for this video. So the cervix does have a small, very small opening in it, and that's sperm kind of travel through that. That's the gateway for sperm to get into the uterus. That's their little passage. It's very small and probably that big. You see the light coming through there. And during labor, this is the really cool part that women's bodies are so awesome for. During labor, that little tiny opening has to get big enough for a baby to come out into the world. So really cool that our bodies can do this, like go from this little tiny little speck of light to like this big. I hope that's like 10 centimeters. Not very good at distance. You can get infections and diseases that affect your cervix, which is probably why your doctor or your midwife would suggest that you get a pap smear on a regular basis or a pelvic exam. My interest in this topic started when we started talking about cervical self-exam in my sociology of women's health class. Cervical self-exam is when you take a plastic speculum. It looks like this. You might have seen one at the doctor's or midwife's. You take a plastic speculum and you insert it into your own vagina. You open it up and you can, through this hole right here, you can see your own cervix. You also want to use a flashlight and a mirror because you're not going to get into a position. I hope you're not flexible enough to get into a position where you could actually like bend over and make that work. Don't try that. So you can buy one of these kits from the Feminist Women's Health Center and you can purchase it online. It costs like $25. They package it all up and they send it to you, which is awesome because $25 and you could be looking at your cervix just like me. Cervical self-exam started in the early 1970s with a woman named Carol Downer who took a speculum from an illegal abortion clinic and taught herself how to see her own cervix. So in April of 1971, Carol Downer went to this convention with a bunch of other women, and their goal was to discuss how to give reproductive health care power back to women. so that they had more power over their own bodies and more knowledge about their own bodies and could make decisions about their own bodies rather than relying on the government or their doctor to make those decisions about their bodies. So really excellent and very important topic, especially when you consider that this was 1971, which was before the landmark Supreme Court case Roe v. Wade. So abortion was still illegal at this time when they're having this convention. So very important thing to note, give you a little bit of context there for what was happening. So Carol's at this convention. She brings her speculum. She brought her speculum with her and ended up showing women, and people were really excited to learn how to perform self-exam. How do I see my own cervix? And so she ended up doing like all these little workshops. It was really cool. I wish I could have been there. That would have been awesome to learn from her. So it became this movement, this thing, and that following fall, so this was in April, and that following fall, Carol Downer and another woman named Linda Rothman ended up traveling across the country on bus and train and making their way to women's health clinics, teaching women, more and more women across the country about cervical self-exam. So that movement just really kind of took off there in the early 70s, and it became a big thing for people to look at their own cervixes, and it was a huge deal. So now that we have the history, maybe we can understand a little bit more about why it's so important to have access and to have knowledge about your body. Just on the very most simplest level, if you get to know your own body's version of normal, your version of normal, what's normal for you, then you can better understand when something's not normal for you. And since all of our bodies are so varied and so different, it's important to recognize that, to know what your own body, what the differences are between your own body and everybody else's, so that you can expect things to be a certain way and know when they're not that certain way. But aside from all of that, aside from just knowing what your version of normal is, you can also use cervical self-exam for tons of other things, not just body awareness. You can use it to tell when in your menstrual cycle you are, including if you're ovulating, and it can also indicate if you're pregnant or entering menopause or even breastfeeding. So obviously, knowing if you're ovulating or not can be really helpful if you're trying to get pregnant or trying not to get pregnant. I do think that it's really important to note here that everyone's cervix is different. So your version of what's normal is going to be different from what everyone else's version of normal is. If you're doing a cervical self-exam and you feel something that's a little bit weird or off, contact your care provider. It's really simple. Just check in, say, hey, this is what I saw, this is what I felt. It's not normal for me. I know what is normal for me because I've been doing this for a while. Can you explain it? In fact, that's actually what I did just like 2 weeks ago, because for this class, my Sociology of Women's Health class, part of my final project and my final paper was to do a 6-week, once a week cervical self-exam. So I'd look at my cervix once a week. And about week 5, I noticed some redness around my os, so the opening of the cervix, and I was a little bit concerned about it, so I just contacted my care provider, and she was really great. She said, everything looks totally normal if you're not experiencing any other symptoms, like good to go, but I haven't had any issues since then, so we're rocking on. Anyways, even though everything turned out to be totally fine, I am really grateful that I talked to my care provider about it, because and I'm really grateful that I was doing cervical self-exam, because 1, I was able to notice when something was weird. I knew what was normal and I knew what was not normal. 2, I was able to get in touch with my care provider and be very specific about what the issue was. Yeah. Anyways, so that's 2. And 3, I just think that with my health, it's always going to be better to be safe than sorry. And that's really the goal here, is that you're safer and you know your body better, and maybe that gives you a little bit more confidence in yourself when you do cervical self-exam. And I think that it did for me. I don't know, it's hard to say, but I'm really glad that I committed to this project and that I actually did this project, and that I get to share it with all of you guys. So let me know what you think. And hopefully everything works out for you and you have a good time.